My name is Kareen, and I'm going to go ahead and clean off my stethoscope from the earpieces down with the alcohol wipe, from the earpieces down to the bevel. I also have here hand hygiene or hand sanitizing gel, additional alcohol wipes, as well as a flashlight. So while this is drying, we're going to go ahead and meet our client. Hello, my name is Kareen. What's your name?
Nicholas Harrison.
Hi, Nicholas. We're going to go ahead and perform a physical assessment for you. Could you tell me your date of birth?
6282.
Okay, let me go ahead and provide some hand hygiene for myself. And we're going to check that information. Nicholas Harrison, 6'2", 1982. Nicholas, are you in any pain?
No.
Good. Okay. Could you tell me today's date?
May 30th, 2022.
And the day of the week?
Sunday.
Okay, so we're going to say that you are alert and oriented times 3. Now I'm going to go ahead and check your head. If you could just kind of face me a little bit, make sure that everything is symmetrical. Eyes, nose, mouth. There's no breakage in your skin, no discolorations. We're going to take a look at your ears. Do you have any issues with your hearing?
No.
Good. Okay. Ears, head looks symmetrical. Your neck looks good. There's no breakage. Good skin turgor there. There's no dryness noted. Let's go ahead and check out your vision. Do you have any issues with seeing?
No.
Okay. Just need you to follow my finger, keeping your head straight. Okay, very good. Do you have any pain or discomfort while you're doing that?
No.
All right. I just need you to follow my finger, or just look straight ahead at my finger. Okay, and you have positive pearla there, or your pupils are round, equal, and reactive to light and accommodation. So that's a good thing.
Oh.
All right, Nicholas, we're going to go ahead and take a look at your lips. I see that they are dry and pink. If you could just open your mouth, we're going to check out your oral cavity. Okay, looks symmetrical. There's no broken teeth. And could you stick your tongue out for me? Okay, and there's no issues there. Do you have any discomforts or any issues with your mouth? Your tongue is symmetrical with good movement. Okay, now we're going to go ahead and look at your upper arms. Could you just put your arms out in front of you, please? All right, so looking at them, there's no open areas, no rashes, nothing to be concerned about. Okay, could you flex your wrists upward? Point your fingers downward, palm up, bend your elbow. Okay. Could you put them back out for me? And go ahead and push my arms up. And could you push me away? All right, so he has good strength in his arms, good skin turgor, no rashes, no discoloration, no open areas to either extremity. All right, Nicholas, I'm going to go ahead and pull the curtain around, provide you with some privacy. At this time, I'm going to need you to take your shirt off. I'm going to get my stethoscope that we cleaned earlier with alcohol, and we're going to go ahead and check out your apical pulse. So we're just going to need you to go ahead and lay back. Okay. So now starting from your sternal notch, we're going to go down about an inch and a half or so. And this is a little protrusion called a sternal angle. If we go over to the left-hand side, this is also his second intercostal space. So we're just going to work our way downward until we count to the 5th. And this is the PMI, or the apex, where we could hear a good heartbeat. And we're going to listen for a full minute, starting now. heartbeat is about 62 beats per minute with good rhythm and is strong. There's no pauses or abnormalities, no signs of any kind of heart murmur there. So now that we've done that, I'm going to go ahead. I noticed a slight discoloration with your chest. Were you out in the sun?
Yes.
You were. Do you use sunscreen or sunblock?
No.
Okay, so I noticed some peeling just to the top of your shoulders here. So I just want to mention that it's very important for you to provide your skin with some sunblock. Um, and when you do go and get it, just make sure that it's like at least a SPF of 15, okay?
Okay.
That's going to protect your skin from the ultraviolet rays, which is a carcinogenic. Basically, it causes skin cancer. All right, so we're going to go ahead. I noticed that your chest rises and falls symmetrically. You're not breathing labored. You have a regular good rhythm. If you could just go ahead and sit up for me and sit back. Let me adjust your pillows. I'm going to go ahead and listen to your lung sounds in the front. If you could just take a deep breath for me. And again. Good. Okay, I'll lean forward. I'm going to listen to your lung sounds from the back. Let me just... Are you in any distress or pain as you're doing this?
No.
Good. Okay. Noticing that your lung sounds are good at 18 per minute. Lung sounds are also clear in all fields. All right, Nicholas, I'm going to ask you to go ahead and lay back with your head on the pillows again. Okay. Notice that there's no open areas or discoloration to your abdomen, so I'm going to go ahead and take a listen. Are you having any discomfort in your abdominal area?
No.
Okay, good. I'm going to start in your right lower quadrant. I'm going to listen to bowel sounds, which I should hear at least every 5 seconds. Go over to the left upper and left lower. And how often are you having bowel movements?
About twice a day.
Good. Okay, so that's important. And that's good. So your abdominal area looks fine and you're not having any pain. So I'm going to go ahead and palpate it. And are you having any pain as I'm pushing down on these areas?
No.
Okay. So his abdomen is soft and non-tender with bowel sounds in all 4 quadrants. Okay, Nicholas, could you just sit up for me? We're going to go ahead and have you sit back. I'm going to take a look at your legs. Come all the way back for me. Awesome. I'm going to go ahead and clean my stethoscope off. All right. Are you having any issues with your legs?
No.
Okay. Now notice that they are no openings. The skin is nice and taut. There's good skin turgor there as well. There's no swelling to either one. There's no discolorations, rashes, or open areas to be concerned of. I'm going to go ahead and check your post-tibial pulse, which you could find just in between the heel and the inner aspect of the ankle. Okay, you have good pulses there, nice and strong with a good rhythm. Then we're going to do the dorsal, which is just to the left of the base of your big toe. Okay, and touching lightly there, I could also feel a good strong pulse. Looking at your toenails, there's no discoloration, no thickness noted. Okay. Skin is all intact in your heels. You have good capillary refill, which is less than 3 seconds. Okay, Nicholas, could you do me a favor and close? We're going to go ahead and check out those sensations. Just tell me where you feel it.
My left arm, my right leg, my right arm, my right leg, my left leg, palm on my left foot, palm on my right foot.
Okay, and I'm going to go ahead and provide myself with some hand hygiene. I'm going to clean off my stethoscope. You go ahead and open up your eyes. Do you have any questions, Nicholas?
No.
Okay, and when you go and get that sunblock from the store, what are you going to look for?
About 15.
SPF for 15 and greater, right?
Yes.
Okay, great. I'm going to go ahead and clean off my stethoscope, and I believe we are completed. Thank you.